Okay, so I'm going to be doing the blood administration video. So first thing I'm going to do is check my chart and check my order to make sure that I'm going to the right patient and that I'm doing the correct thing. And then I'm going to gather up all of my supplies and wash my hands. Knock, knock, knock. Hi, Mrs. Jones. My name is Lane. I'm going to be your nurse today. I understand that you are going to be getting a unit of blood because of your bleed. So I'm just first going to check your name band here. And then could you tell me your name and date of birth? And she does, Betty Jones, 5/21 of 1952. Okay, so I'm just going to provide some privacy here. So I know that you understand that you are going to be getting a unit of blood today, and I can see that you have signed your consent already, so that you understand and you're aware of what's going on. I just wanted to let you know that I will be with you while you're getting your blood for the first 15 minutes, and then I want you to let me know if you are feeling any signs of nausea, or you're starting to feel dizzy or sick. I'll be watching for any like hives or anything like that. And then yeah, you just let me know if anything feels out of the ordinary. Okay. All right. And I think I'm just gonna get. I'm just gonna make sure that I've got all my supplies here. I've actually sent my coworker to go get the blood, so I'm just gonna kind of get everything set up and ready to go for when she comes back. So I'm going to make sure that I have checked her vitals to make sure that she's able to get the blood and she's good to go. Okay, so I'm going to grab my normal saline, which is the only thing that you can use to run blood with. Just want to check to make sure everything looks good and that the expiration date is fine. Okay. And I'm gonna grab my blood tubing. Get this all set up for you. Clamped up. Alright, so I'm just gonna get some normal saline. I'm just running through to the end of this line. Just want to make sure that there are no air bubbles in the tube. And also want to make sure that the saline is over. Oh. Just over the top of this filter so that the blood cells don't lyse. Alright, and then it looks like there are no bubbles. This tube is a little rough. Okay, alright, so I'm just gonna hang that right there. Okay, while we wait for the blood to come. Okay. All right, so I'm gonna just check your site here, and just make sure that there's no redness or swelling, and make sure that everything looks good for you to be getting your blood. Okay. And I'm also going to check for patency of your line here. So I use a saline flush. I'm going to flush this. Do you feel any pain at your site or anything like that? Okay, and she says she doesn't. So at this point, I would wash my hands and then put on some gloves. Okay. And I'm just going to wash this site for 15 seconds. This flush on. And I would obviously want to make sure that there's no bubbles in here. Okay, make sure there's no bubbles in my flush. And there aren't. It'll look kind of like there is a bubble, but. Alright. And then just put this in slowly and make sure that it was patent. Okay, so I'm just gonna verbalize that I did that since it won't go in. Okay, all right, and it went in fine. And did you feel any pain or anything, Betty? And she didn't. So okay. Okay. All right. So, and it looks like the blood is here now. So just gonna take this blood and take a look at it, make sure that it looks good, and check the expiration date. And I know that when I get blood, I need to make sure that I start the infusion within the first 30 minutes of receiving it. And also I'm going to have my coworker double check this with me so we can have 2 checks. Okay, so I've got Betty Jones here.
Yep, Betty Jones.
Yep, and then 5/21/1952.
5/21/1952.
All right, and we've got a med record of 224466.
224466.
And her red armband states 456654.
456654.
Account number 123456.
123456.
All right, and blood type is B positive.
B positive.
And donor pool 7890.
7890.
Yep, okay, and then it looks like expiration date here of 12/22 of 2020.
12/22/2020.
All right, perfect. So looks like she's all good to go. And then I'm just going to ask you one more time, could you just verify your name and date of birth, Betty? And she does. All right, so I'm going to get this ready to infuse. So I would, since I already have gloves on, I would have washed my hands and already put on a new pair of gloves. Oh, jeez. Okay, so make sure that my, have to make sure that my locks are locked. Okay, well, that fell apart. So I'm just going to make sure that my saline bag is now locked as well. So I'm going to check these, make sure they're locked up. This one is locked. And and so I'm going to make sure that I get my blood flowing through to the end of this line, so that I know that my patient is getting blood, especially when I'm here for this first 15 minutes. So I'm going to lock this, keep this really locked, and bring this up. And then just make sure that it's running pink all the way down. And it is. Okay. Alright, so I'm going to get a new patient here. Right, I'm going to be saying LB, guardrails fluids. Got 1 unit of packed red blood cells. Alright, and I'm going to be starting this at a rate of 50 mils per hour. And I'm going to be setting it at 200 mils so that I get on dry. Alright, and then we have this cleaned off and get this hooked up. And then start. Okay. Alright, so I've got her infusion running. And now I'm gonna make sure that I stay with her for 15 minutes. At least the first 15 minutes, to make sure that she's not having any adverse reactions or an allergy to the blood. Make sure that she doesn't spike a fever, feel nauseous, and just kind of keep an eye on her. I'd also be checking her vitals every 15 minutes, every 30 minutes, and then 1 time per hour after that until the infusion is done. Make sure that it doesn't run for any longer than 4 hours, and also make sure that if I need to give her more than that, that I would change my tubing every 4 hours as well. And also when it was done, I would make sure that I would clean out, open the saline back up and clean the rest of this blood out of the line so that we didn't waste any of it. Alright, so I'm gonna take off my gloves and just wash my hands up, throw all of my supplies in the garbage, make sure that she's comfortable, has her call light, and put her back down to resting spot and see if she needs anything else. And then I will wash my hands again and document the blood information, blood type, armband, donor pool, all of this blood info, expiration dates, how her site looked, and how she reacted to the infusion. And that's it.